My name is Julie Van Newkirk. I am 35, going to be 36 on Monday, the 14th. I just completed the 2-week accelerated program at the treatment center down here in Dallas. I think it's safe to say that when I first got here, I would not be able to have this discussion right now because any sort of long conversation or talking or whatnot, I would lose my breath and would have to go lay down for 20 minutes to get it back. So it has been an amazing experience. It's amazing in the ways of, I feel like I have hope again, that I have my life back. I know it's crazy to say after only 2 weeks and after suffering for 4 years, but little things like taking a shower and not needing 2 hours to do it because I can't stop sweating after. That's done. That's over. Walking, I can actually walk without having to stop, sit down, pant, not pass out, sweat profusely. All of those things are gone, even though I am in a much warmer climate than up in Michigan where I live. My depression and anxiety before I got here was, was to the point where I'm on like 5 different medications for it, and I think it's safe to say I can talk with my psychiatrist when I get home about coming off of most, if not all, of my medicines for those. And that's amazing because that's been a huge, that's been probably the hardest thing that I've had to deal with this illness because of the impact those 2 things have had on my family. I have twin sons who are 6, and I have been sick since they have been probably 2.5. So they don't know me as a mom, really. They know me as the woman who lays on the couch all the time and can read them books and watch movies with them. I have a woman who cleans for me, does my laundry, and sometimes cooks, and cleans my house. I'm hoping that in the near future I will be able to do those things because as a wife and a mother, that is my job. My husband has been through the ringer. I won't even go into that. But it's really been a hard 4 years on our marriage, and I am more than hopeful that the bad times are behind us, and it's only new beginnings from here on out. Dr. K and Andrea and Katie and Dr. Townsend and everybody else here at the clinic have been absolutely amazing because they understand. It's really hard to find people who really understand the impact that this illness has on an individual's life. No 2 people are the same with POTS. Everybody's symptoms are different, but the underlying truth is the same, and that is that we don't have a life. But they understand that, and they can empathize with us, and they have a program put in place that is so simplistic. I hate to say that, but it really is, and it makes so much sense, and it has literally brought me back from the dead, I guess you could say. I had given up all hope before coming down here. I mean, there were days I didn't want to get out of bed, because of the depression, and I have yet to kick a soccer ball around my yard with my sons, and that is going to be one of the first things that I do when I get home. And it's overwhelming because I never thought I would be able to do that. And there's a lot of things I'm going to do when I get home, including losing weight, because these stinking meds have doubled my weight in 2 years. But we won't talk about that because I'm too angry. But I know now that I can exercise, and I hadn't been able to do that for 4 years either. I have all the tools that I need to live a normal life again. And to anybody out there, I don't care if you're a mom and you have a child who has POTS, or if you're 80 years old and you have POTS, you can get better. Don't let anybody tell you otherwise. All it takes is a positive attitude, determination, a plane ticket down here, and just the effort to do the work, and you will get your life back. I'm a walking testimony. And for a while there, I didn't think I would be walking much longer. So I don't know what else to say except thank you, Dr. K. Thank you, Katie. Thank you, Andrea. Thank you, Dr. Townsend, for not only giving me my life back, but for giving my twins their mom back, and my husband his wife back.